So my name is Angus Dawson. I'm a Professor of Bioethics here at the Centre for Biomedical Ethics at the National University of Singapore. So welcome back to the fourth lecture in this series where we're looking about issues to do with socioeconomic determinants of health and more broadly health and justice. So in this talk I want to work through some of the implications of the issues that we've been considering in the earlier lectures. So if we ask the question, how should we design a health system, there are a number of different factors we can take into account. The key element that we've been focusing on so far is thinking about the different kinds of causal impacts upon people's health. So choices, autonomous choices are part of that, but we've been exploring those other kinds of structural factors that also impact upon people's health. But if we're designing a health system, we have to be aware of how the assumptions that we might have about what causes people's health states impacts upon the kinds of factors, incentives and so on that we create within the healthcare system. But there are also other factors to take into account, such as the overall cost of the healthcare system, the kind of efficiency that is going to be there, ideas about sustainability, so that could be the direct issues to do with the impact of the health system upon the environment, but also the sustainability of the system itself. If, for example, you have a small group of people that have very expensive health needs, then that could raise questions about the sustainability of the whole of the system in relation to health. And lastly, this goes back to the third lecture, we need to think about issues to do with justice. So what's fair or what's just in relation to the kind of healthcare system that we have? So part of the different elements that we might take into account when designing a healthcare system is raising some questions about what it is that we think health is and what kind of place it has in relation to other kinds of things that we see as being important. It's very common for people to argue that health is somehow foundational. And I think what they mean by that is that health is a prerequisite for other kinds of opportunities, other kinds of plans that they might have, other kinds of objectives that they might have in their life. So we could also see health as being something that is potentially a means to other kinds of ends. So the thought is that you have greater opportunities if you are healthy. We also need to see how health can relate to other kinds of policies, and this is something that came up in lecture 2, thinking about the way that issues related to health interact with and make a difference to other kinds of factors within society. For example, ideas about education and health interact with each other. But one of the things that I want to focus on for the rest of this lecture is thinking about how healthcare systems need to also link up with thinking about public health. So the focus here is not just upon individual health states and clinical care that relates to those individual health states. And we can see the role that public health can play here, particularly in relation to the concept of prevention. So the thought here is that if we are concerned about how the socioeconomic determinants of health impact individuals' health, and we can identify ways that we can intervene to prevent various harms from occurring, then we have a justice-based reason to actually do that. So we can go back to thinking a little bit about what we mean by public health And here's just one of many different definitions of public health that have been provided. So here, thinking about collective interventions that aim to promote and protect the health of the public. This idea has two elements to it in terms of thinking about the health of a population or a group. So that's a sort of metaphysical claim about what the focus actually is, and that allows us, for example, to compare different subgroups within a population or look at the whole of a population over time. Is health in relation to a particular condition improving or getting worse? But it's important to see that the second element here also provides an opportunity to think about how the actions of public health through, for example, the role of laws or government activity can provide opportunities through collective action. So this links up with thinking about healthcare systems and thinking about public health, because we are not just focusing here upon individuals and the choices that they make. Of course, this is not an argument to say that individuals themselves don't actually have some agency in relation to the choices that they make that impact upon their health. It's just a question of we might be able to actually intervene collectively to prevent or reduce the chances of various harms occurring within a population. And here's an example of work done in epidemiology that can be used to demonstrate this. So here we have ideas about how a particular health condition, in this case the work was done by Jeffrey Rose, and he was looking at hypertension and salt consumption in society. And the thought was that if, for example, there were regulations about reformulating food products and the amount of salt that they had in them, you could actually benefit the whole of population and essentially do what he called shifting the curve down from A to B. So the distribution there is a population-wide distribution, and you've had an impact through thinking about how we can intervene collectively to actually prevent various kinds of harms existing. Now, of course, there will be a distribution there, always within society. Some people have greater problems than others, so there is always an argument for the role of information or the role of clinical intervention in relation to individuals. But the thought here is that questions to do with the socioeconomic determinants might well be addressed by thinking about population level interventions to try and benefit everybody within a society. So the conclusions to this particular video, but also more generally this series, what I've tried to suggest is that we can raise some questions about the degree to which our individual health states are totally within our individual control. And what I've tried to suggest is that there is some degree to which we are able to, of course, behave in particular ways as individuals that negatively and positively impact our health. There is responsibility in relation to that degree of influence. But there are these other factors in the background which are much less plausibly seen as being within the control of individuals. And the kind of structural features, such as the socioeconomic determinants, are things which are not under the control of the individual themselves. So when we think about the design of healthcare systems, particularly if we're interested in the role of public health, particularly ideas about prevention, then we are pushed towards a suggestion that issues to do with justice, taking into account the socioeconomic determinants, relate to how we as a society can address these questions through, for example, the coordinated action of society, and very often that is something which is carried out through the action of the state, different kinds of regulations, different kinds of laws that help allow all of us to have flourishing lives together. So thank you, I will end there.